This video of mine is about Paronychia, which is an infection of the skin around your fingernails and toenails. Bacteria are a type of yeast called Candida typically cause this infection. Bacteria and yeast can even combine in one infection. Earlier, I posted a short video about Paronychia on this channel. I hope you have already seen this video, and today I am going to discuss this illness in detail. Well, depending on the cause of the infection, Paronychia may come on slowly and last for weeks, or show up suddenly and last for only 1 or 2 days. The symptoms of Paronychia are easy to spot and can usually be easily and successfully treated with little or no damage to your skin and nails. Your infection can become severe and even result in a partial or complete loss of your nail if it is not treated well. Paronychia can be either acute or chronic depending on the speed of onset, the duration, and the infecting agents. Acute Paronychia almost always occurs around the fingernails and develops quickly. It is usually the result of damage to the skin around the nails from biting, picking, hangnails, manicures, or other physical trauma. Staphylococcus and Enterococcus bacteria are common infecting agents in the case of acute Paronychia. Chronic Paronychia can occur on your fingers or toes, and it comes on slowly. It lasts for several weeks and often comes back. It is typically caused by more than one infecting agent, often Candida, yeast, and bacteria. It is more common in people who are constantly working in water. Chronically wet skin and excessive soaking disrupts the natural barrier of the cuticle. This allows yeasts and bacteria to grow and get underneath the skin to create an infection. Now I'll tell you the symptoms of Paronychia. The symptoms of both acute and chronic Paronychia are very similar. They are largely distinguished from each other by the speed of the onset and the duration of the infection. Chronic infections come on slowly and last for many weeks. Acute infections develop quickly and do not last long. Both infections can have symptoms such as redness of the skin around your nail, tenderness of the skin around your nail, pus-filled blisters, changes in nail shape, color or texture, detachment of your nail can also occur. Now I will tell you the causes of Paronychia. As I said earlier, there are multiple causes of both acute and chronic Paronychia. The underlying cause of each is bacteria, Candida, yeast, or a combination of the two agents. In acute Paronychia, a bacterial agent that is introduced to the area around your nail by some type of trauma typically cause an acute infection. This can be from biting or picking at your nails or hangnails, being punctured by manicurist tools, pushing down your cuticles too aggressively, and other similar types of injuries. Chronic Paronychia. The underlying agent of infection in chronic Paronychia is most commonly Candida yeast, but it can also be bacteria. Because yeasts grow well in moist environments, this infection is often caused by having your feet or hands in water too much of the time. Chronic inflammation also plays a role. Now I will tell you about the diagnosis of Paronychia. Well, in most cases when the patients come to us, we usually diagnose Paronychia simply by observing it. And your doctor may send a sample of pus from your infection to a lab if treatment does not seem to be helping. This will determine the exact infecting agent and will allow your doctor to prescribe the best treatment. Now I will tell you the treatment of Paronychia. Home treatments are often very successful in treating mild cases. If you have a collection of pus under the skin, you can soak the infected area in warm water several times per day and dry it thoroughly afterward. You can do it 3 to 4 times a day. The soaking will encourage the area to drain on its own. And then in some cases we prescribe an antibiotic such as clindamycin or cloxacillin, because as I said earlier, the bacteria are common causative agents in acute Paronychia. Or in case if the home treatment is not working for a few days, then it's better to get a prescription of an antibiotic from the doctor. You may also need to have blisters or abscesses drained of fluids to relieve discomfort and speed healing. This should be done by your doctor in order to avoid spreading the infection. When draining it, your doctor can also take a sample of pus from the wound to determine what is causing the infection and how best to treat it. Chronic paronychia is more difficult to treat. You will need to see your doctor because home treatment is not likely to work. Your doctor will probably prescribe an antifungal medication and advise you to keep the area dry. In severe cases, you may need surgery to remove part of your nail. Other topical treatment that block inflammation may also be used. Well, as I told you, that since there is a chance that chronic paronychia is caused by fungal infection and bacterial infection are in combination, then we have to prescribe some antifungal medications such as clotrimazole, and some other creams, antibacterial creams are in combination, and you have to take this treatment for like so many weeks, okay, and even months, because this is it's not easy to treat chronic paronychia, okay. Now I will tell you some preventive measures, okay, to prevent paronychia. Good hygiene is important for preventing paronychia. You should keep your hands and feet clean to prevent bacteria from getting between your nails and skin. Avoiding trauma caused by biting, picking, manicures or pedicures can also help you prevent acute infections. To prevent a chronic infection, you should avoid excessive exposure to water and wet environments and keep your hands and feet as dry as possible. The outlook is good. If you have a mild case of acute paronychia, you can treat it successfully and it is unlikely to return. If you let it go untreated for too long, the outlook is still good if you get medical treatment. Chronic infection is likely to last for weeks or months. This can often be more difficult to manage, so early treatment is recommended. Well, this was my video about paronychia. If you have any questions about paronychia, then you can post comments, okay.